Everyone, welcome to Listen Once and Never Forget video series. The only thing that is constant in medical field is the number of organs that are present in our body. The organ systems which are present are constant, but there can be innumerable diseases, there can be new drugs added to the present lot of drugs. Yeah, but the organ systems are constant. Okay, now see this. You know this, right? It's respiratory system. Okay, so lung, take the lung. If there is a disease of the lung, maybe assume it's a cancer, any doctor would refer the patient to a pulmonologist. In simple terms, lung specialist. Okay, so to treat the diseases of lung, you need to become a pulmonologist. Fine. How many years does it take to become a pulmonologist? Or any super specialist for that matter? It takes nearly a decade. Does that sound so horrible? Just to treat one organ, we need to spend time of a decade. Is that really that tough? No, it is not. Can an MBBS student also think like a pulmonologist? Yes, of course, why not? This is just the clinical thinking that we need, the mindset, how to approach a patient. So, in this series, I'll be talking about topics system wise, breaking the barrier of subjects. There would be no anatomy separate, microbiology separate, nothing like that. It would be just the respiratory system. In this respiratory system, anything and everything can go wrong at any point of place. So I'll be discussing all of them one by one. Oh, sorry, I forgot to introduce myself. I'm Trupti, a second year MBBS student at Bangalore Medical College. If you have any suggestions for this video series, please do let me know. Okay, so this is how I would like to proceed. In the nose, the congenital anomalies, parts of nose like external nose, lateral wall of nose, nasal septum or the medial wall of nose, its nerve supply, blood supply and all the diseases associated with them. Next, coming to the paranasal sinuses, we all know there are 4 pairs of paranasal sinuses. I'll be discussing about that. And the nasal polyps, which are very common. Again, allergic rhinitis, very prevalent in the population. Fractures of nose, there may be a road traffic accident or some trauma and that the nasal bone might get fractured, get deformed. Okay, and then tumors of the nose and paranasal sinus. Yeah, again pharynx, its anatomy, adenoid hypertrophy, angiofibroma, nasopharyngeal carcinoma, tonsils, which has tonsillitis, a surgery called tonsillectomy, and a quinsy, a painful disease like that. Okay, don't worry if you don't know all these terms, which they might be new for you, but it's fine, you'll learn. And then coming to larynx, the voice box, its anatomy and congenital malformations, voice disorders, vocal cord palsy, tumors of larynx, and in the airway there may be a foreign body or there may be malformations, and even a note on tracheostomy will be dealt. And then pulmonology, lungs, its anatomy, physiology, and the basic investigation that is performed to diagnose lung diseases, that is pulmonary function tests. Infections like pneumonia, pulmonary eosinophilia, ABPA, allergic bronchopulmonary aspergillosis, hypersensitivity pneumonitis, and bunch of disorders like bronchiectasis, bronchial asthma and its drug therapy, even COPD and its drugs, OSAS, obstructive sleep apnea syndrome, restrictive lung diseases, that is interstitial lung disease, occupational lung diseases, respiratory failure, acute respiratory distress syndrome, pulmonary hypertension, venous thromboembolism, and a genetic disorder called cystic fibrosis. even the drugs, the pharmacological aspect, like suppose beta 2 agonists, which are used for asthma, I would be discussing there itself, not as a separate drugs ka video. Yes, right. Okay. In the end, after you know everything, what all diseases are there, how they can present, it will be like a summary to discuss the symptoms and how to approach to the respiratory system ka case. How will you decide whether this patient has a problem in respiratory when he comes to the OPD? History taking the most important part for a clinician, which makes everything, like the most of the job is done by history taking itself, and also the examination part. So yeah, this is the journey that we'll be going through in next few days. Okay, then see you till then. Take care. Bye bye. Thank you.